Medicare costs have just been released for 2022. The Center for Medicare Services every year comes out with projections and then they release the actual increases. I don't recall ever seeing a decrease in the cost of Medicare, but this year it's a surprise. So it's much higher than what they projected just a month ago. So I'm gonna go through all that right now, what they've done to Medicare Part B, drug plans, Medicare IRMA, all that. And I'm Keith Armbrecht, founder of Medicare on Video. I help people across the country make the right Medicare choices, and I can absolutely help you as well. One of the best parts, there's no cost to you to allow me to help. So hopefully you'll allow me to help you set up your Medicare and get everything done right from the beginning. So we're going to go through Medicare price increases, and that's exactly what they are. So do me a favor right now, subscribe to my channel, hit the like button and hit the bell button. That way you'll always have access to my videos and you'll get notifications each time I do a new video. And this is stuff you're going to want to know as you go through your Medicare journey. So right now, let's get into these cost increases. If you recall, about a month ago, you heard if you're on Social Security, you got a pretty nice bump, one of the biggest bumps to Social Security in quite a long time. Well, guess what? Now they come along with the Medicare increases, and it's going to take a chunk of that increase to Social Security kind of as you go, but it's not as big as the increase in Social Security. So that's the good news, but an increase is an increase. So let's figure out exactly what they've done. And when we're talking about Medicare, we're talking about original Medicare, Medicare Part A, Medicare Part B, Medicare drug plans, which are Part D, and drug plans and Part B premiums are income adjusted. So the more you make, the more you pay. So they've had increases as well. But we're going to talk about the basics right now. I'll do videos specific to the others as we go. When we talk about the premium for Medicare Part B, you do pay a premium every month for your Medicare Part B. Whether you're in a Medicare Advantage plan, whether you're on original Medicare with a supplement, you have your Part B premium. And if you're on Social Security, they likely take it out of your Social Security check. If you're not on Social Security, they would direct bill you. And when they bill you quarterly. So you have to pay it 3 months at a time. So a lot of times it's certainly easier to have it come out of your Social Security. But anyway, it's going to come out one way or another to have your Medicare Part B. And right now, the premium for Medicare Part B is $148.50. So you can look at your Social Security statement, you would see a withdrawal or an adjustment for $148.50 for Medicare Part B. So what that is going to go to in 2022 is $170.10. Now that's a big increase, and you know, it's something we don't want to face. And I've been doing this for a long time, and this happens every year. And generally that Part B premium goes up $3 a month, goes up $5 a month. You know, it's manageable. It's something we can deal with. This year it's going up $21.60. So a big jump in the increase of that Medicare Part B premium. And it's really not time that we don't need an increase like this. We've got inflation right now that's running at a 30-year high. So everything costs more, whether you go to the gas station, the grocery store, whatever it may be. And guess what? Now your Medicare Part B is also going to cost more. But let's kind of keep it in perspective that in reality, Medicare is terrific. It's very good insurance, very good on coverage, and the cost of it, while there is a cost, is generally less than what it would be for your regular health insurance that you may have had previously. But a lot of folks will say, hey, I've paid all my life into Medicare. Why am I still paying for Medicare as we go? And it's a great argument. I mean, obviously, we've been paying, some of us, for 30, 40, 50 years into Medicare, and now we still have a premium when it comes time to use it. So it's a tough argument to really fight against, but that is the way it is. Comment below and tell me what you think about, you know, having to pay a premium even though you've been paying in, you know, with your Medicare tax all these years. And that's part of kind of how government works is, you know, they're never really very good with managing their programs. And Medicare is absolutely one of the best government programs out there. So let's talk about the deductible on Medicare Part B. So Part B covers stuff that happens outside the hospital, doctor's visits, outpatient surgery, rehab, things like that. And when you utilize those services every year, starting in January, you first have a deductible before Medicare is going to pay. And fortunately, it's a very small deductible, so it's not very big. Right now, it's $203 a year. So in other words, you pay the first $203, and then Medicare is going to start paying after that. So that deductible is now going to go from $203 to $233. So it's going up $30 for the year. And again, it is an increase, but in the relative scope of things, $233 deductible on your medical insurance, not a whole lot. So compared to what you may have had previously, a lot of employer plans or certainly individual plans have $2,000 deductibles, $3,000 deductibles, even higher than that. I've seen them $10,000 deductibles before the insurance company starts to pay. Medicare is going to start paying after you've come out of pocket $233 January to January. So just keep that in mind. It runs annually. So, it's once a year for that scenario. Now, Part A is the other piece of Medicare for stuff that goes on inside the hospital, and it also has a deductible, and it's a much bigger deductible, but most people don't usually see that deductible because if you're on original Medicare, you likely have a supplement plan, an F or a G or an N, that goes along with the original Medicare, and it pays the hospital Part A deductible. So that's why pretty rare for you to run into that. But right now, that deductible is $1,484. So $1,484, and it's not annual. It is per occurrence. So you could actually run into that deductible multiple times during the year. And man, that's a big number. So almost $1,500 for a Part A deductible. But again, if you have original Medicare, you likely have a supplement plan that pays it. So you don't have to worry about it. Now that deductible is going to now go to $1,556. So it's going up $72. Again, not a big deal. And again, since generally you don't pay it, then it's not something that's really going to affect you a whole lot. So that gives you a pretty good idea. Now let's kind of understand on what this is going to affect. And I'll tell you right now what Medicare says justifies these increases. So, I was Googling around earlier trying to figure out who makes this decision, who decides how much things are going to be. And what CMS says, so whoever is at CMS, says that rising prices and utilization across the healthcare system that drive higher premiums year over year alongside anticipated increases in the intensity of care provided. Congressional action to significantly lower the increase in the 2021 Medicare Part B premium. So what's happened is last year, Congress did something to make last year's increase not as high as it should have been. So what's happening now is not only do we get the normal increase for 2022, but we also get what should have happened in 2021. So we're double dipping here on the increase in 2022. So I'm not sure that we have any justifications. I don't recall Congress talking about it this year on whether they're going to do something. And that's kind of the crazy part as well, is that they're talking about they want to add things to Medicare. They want to expand Medicare when Medicare is not in fantastic financial condition. So Medicare is slated to run out of funds completely in 2026. And obviously, it's very likely that Congress will do something about that, but I'm not sure how we can look to add to Medicare at a time when Medicare is struggling financially on its own. Another reason that they cite for the increase is additional contingency reserves due to the uncertainty regarding the potential use of the new Alzheimer's drug. So they came out with this new drug that supposedly helps Alzheimer's, but it was crazy expensive. I didn't go back and look at it, but I recall it being somewhere around like $40,000 per dose of this drug, which is just unbelievable. And then I also recall shortly after that talk about that it may not actually be all that it's supposed to be. So I'm not sure how stuff like that gets approved and then that Medicare is going to pay for it and it's going to cost all of us more on our Part B premium. Also kind of crazy. But those are some of the issues that they say causes things to go higher. And, prescription drugs, obviously a big deal. And Medicare again, another thing that it just doesn't make any logical sense, why Medicare can't negotiate prices on prescription drugs. And, forget about lobbyists or anything like that. It just doesn't make any sense. Who would care just because the lobbyist, is pushing against it, that we wouldn't negotiate prices of our drugs? Kind of crazy. But those are some of the things that, obviously goes back and forth, and our political landscape is just so out of whack right now. It just doesn't, things likely aren't going to get any better. But we've got to manage what we got, and what we want to do, let's figure out what this actually means. So we have Part A deductible going up, Part B deductible going up. So what that's going to mean, Part A, again, most supplement plans cover that. So that's likely going to lead down the road in a domino effect some possible rate increases on Medicare supplements because their costs are going up. And so what that means to us is we got to be vigilant in shopping our Medicare supplement plan every single year, because supplements are standardized. So a G is a G, an N is an N, and F is an F. Doesn't make any difference what insurance company we use. We need to get the best price. So that's something else that we do very well. And I'll tell you at the end of the video, I have another website called Medicare Price Check, where every year we need to do a Medicare price check and see if we can save $10 a month, $20 a month, even $40 or $50 a month for the exact same coverage on a Medicare supplement plan. So something we can do anytime during the year. You don't have to wait till open enrollment to do it. We need to do it. If you get a rate increase, go to Medicare Price Check, and we will run a complete quote on everything in comparable to that plan and try to lower some prices. Now, with Part B deductible going up, what that means, we're all mostly responsible for Part B unless you're still on old Medicare Plan F. That covers the Part B deductible. What that means, Medicare Plan F, that covers the Part B deductible and the Part A deductible, likely going to have rate increases. So now is a fantastic time to come off of Medicare Plan F. It's always been a good time to come off. We can save a lot of money coming off of Plan F and get you equally good coverage at a much lower cost with very little out of pocket. So anyway, visit Medicare Price Check. I'll show you that in just a minute as well. This kind of wraps up our cost increases for 2022, and good thing is we won't hear about it again until 2023, and hopefully it won't go up quite as much as it did this year. Please, if you have any questions, contact us. I have a small team. We're happy to help with any of it, and we will make sure we get you in the most advantageous position for your Medicare so that things go the way they're supposed to and you have no problems down the road. So I hope you found all this helpful. Stay tuned. I'll show you how to download my book and visit Medicare Price Check. Have a great day. Subscribe to the channel. Thank you for taking the time to watch my video. I hope you found it very helpful. Here are a couple other things that you'll also find helpful as you go through Medicare. The first one is a copy of my book, Medicare Made Clear. You can download it right now for free. I've put a lot of time and effort into this book, and you'll see I cover just about every piece of Medicare, and I've written it in a way that makes it pretty easy to understand. Now, I also have videos throughout the book, so if you don't want to read through all the information, click on the video and I'll explain it all to you right there. You'll also find all the links that you need to either sign up for Medicare or things that you're going to need now or in the future when things come up related to Medicare. So take just a minute, go to medicareonvideo.com/free book, and you can download it right now. Now also make sure once you're in Medicare that every year you come back and visit Medicare Price Check. This is my other website where I make it super easy for us to compare our current coverage against new plans that may be less expensive. And remember that Medicare supplements are standardized, so it doesn't matter which insurance company we use, we'll still have the same Plan G or the Plan N that we have now, but hopefully we can get it at a lower price. So visit MedicarePriceCheck.com. Real easy. We'll email you the quote. If it makes sense, then we'll do it from there. So I hope you found all this helpful. Have a fantastic day. Hey, don't go anywhere. These are some of my most recent videos right here. You can also find the link right below this video to download my book, Medicare Made Clear, absolutely free. You can also subscribe to my channel right here. So please download my book, watch some videos, subscribe to the channel. Have a great day.